Hey, it's Dr. John Tait, non-surgical orthopedic doc, and today I'm talking about some new technology that we're using in my practice with my good friend here, Dr. Glenn Copeland. So, Dr. Copeland, let's lead off with you. Tell the audience a little bit about you and what do you do?
Well, thanks for having us here today, Dr. Tait. We're incredibly excited to bring to Tucson and the Southwest, if you will, this great technology we've been using in professional sports medicine and bringing it to the people of Tucson and southern Arizona. The technology is been around about 25 years. We've have now over 300 professional sports teams using what we call extracorporeal shockwave, or for short form, shockwave therapy. Not to be confused with shockwave that you attach to the body and of course class 4 lasers. Extracorporeal shockwave has been around now for 30, 40 years, probably longer. Many people know it because it was originally used and still is used to break up kidney stones. The old name for it, which is well known and well documented in medicine, is lithotripsy. And lithotripsy is really just sound waves, if you will, very heavy duty sound waves, ultrasound on steroids, if you will. And but this sound wave, not only if it can break up a kidney stone, can you imagine what it can do for inflammation? And so we've been using this, started back in about 25 years ago, just before the turn of the century, with pro athletes who, can't afford downtime. They got to get over an injury, get moving, get rid of their inflammation. And I guess if there's any great genius, myself and a number of our ATC trainers in Major League Sports got together and looked at the possibility of marrying class 4 laser, which is a light source, with this sound source of shockwave. And I'm very pleased to tell you that the combination has worked exceptionally well, almost no side effects, and long-term healing that really doesn't allow for too many reoccurrences. So whether we're talking about plantar fasciitis, Achilles tendonitis, knee pain, what we call patellofemoral syndrome, low back pain, tennis elbow, golfer's elbow, and different numbers of issues with the shoulders. And I hope all the pickleball players in the Tucson area are listening to this, because they're our real focus audience. Yeah. And so we're seeing just a tremendous number of our pickleball players, tennis players, runners, golfers, coming to Dr. Tait's office, seeking to get back on the golf course, get back in their running shoes, get back on the pickleball court, get back into the tennis. And the beauty is that we're seeing these people who've been told that there's really nothing to be done, because they see some an orthopedic surgeon who does surgery, and many of these people are not surgical candidates for many reasons. Either surgery won't help them, or they're not a good candidate for surgery for underlying conditions. So here we are, and getting them back into the playing. So it's been exciting over the last 25 years to see this really unique marriage between light and sound, taking care. And again, as I said earlier, so few side effects, if any.
Yeah. So let's break these down individually, because we're sequencing these treatments in a very unique way, using 25 plus years of Dr. Copeland and his team's understanding of this and evolution of their protocols to get the best possible outcomes in their treatment. But let's take each technology separately. We heard a little bit about the origin of shockwave, how it's used for kidney stones, and then one of the original kind of aims of this, which is very interesting, because Dr. Copeland's a foot and ankle surgeon by training.
Yes.
So I'm a non-surgeon by training. He is a surgeon by training. But tell us about the interesting study that they did, the failed study that turned out to work really well.
Well, this was the best part. Many years ago, one of the original companies who was doing lithotripsy for kidney stones said, well, they thought for sure that if it would break up a kidney stone, it would break up the heel spur, which was thought to be, if you will, the plantar fasciitis, or cause of plantar fasciitis. And so we set out to look at this, and we used those big lithotripsy machines, which were very painful back then, on about 100 patients in the southeast of the U.S. And lo and behold, the company at the time that was making the machine said, well, we'll take x-rays at 1 month afterwards, 3 months after, and 6 months. And they were very disappointed to see that the heel spur didn't disappear.
But what happened to their pain?
Well, this was the best part. So myself and the other foot and ankle doctor that were involved with the study, what we did, we weren't interested as much in the x-rays, we were in how the patients were doing. And lo and behold, about 95% of them, their pain had gone. It had disappeared. And of course, the company that made those big and very powerful shockwave machines lost interest. But we realized we were onto something much bigger in treating all these conditions, whether it's plantar fasciitis, epicondylitis, which is golfer's elbow, tennis elbow, and all these conditions that are caused by tendons, if you will, pulling away from the bone. And we realized that at that stage that the spur itself was just really a symptom of the muscle and tendon pulling off of the bone. And that by using this great sound wave, that it was the beginning of finding a way to reattach. And lo and behold, it was about 2 or 3 years later that we added the laser in. Yeah. And so you marry the sound wave with the laser, and the success rate, when used properly in the right hands, and nobody better than a physiatrist like you, Dr. Tait, who is a non-surgical rehab medicine specialist, to treat and diagnose it. The key here is getting the right diagnosis. And that's where we find that docs have to have that incredible background in physical medicine. That's where this starts, is making sure that the diagnosis is correct. And once you have that, then prescribing and using extracorporeal shockwave and class 4 laser is very, very exciting.
So let's stay on that for a minute, because of course, as I talk about, and I've done content on this, we have to have the right diagnosis, the root cause, to get to that pain generator, to then match the right treatment to it. Because look, we can't hit everything with the same hammer and expect it to go away. We need to have the right diagnosis and then match this right complement, sometimes not a singular treatment, but a complement of treatments around that problem to really get it to heal. That's why I use platelets and stem cells and my therapies and treatments in the office to stimulate things to heal. That's why we talk to people about nutrition, basic lifestyle upgrades that can help them heal. But I'm really interested when you took this, so you took shockwave and you carried this forward for a while with your team, and you did a lot of training overseas in Europe, where they seem to be using a lot of things that we just don't use in the U.S. at the leverage it can offer for patients. So talk a little bit about what you guys evolved with shockwave, and then when you did say, let's put this laser on top of this, then what really happened? So
the beauty of shockwave and what you're doing with the stem cell and PRP, all of it really marries, because we're all trying to get rid of the inflammation and allowing it to heal. So shockwave, the real treat to shockwave is something called angiogenesis, a big medical word meaning rebuilding blood supply. So we know that the beauty of sound wave is actually to rebuild the blood supply to a given area. When we take the light wave, the beauty of the light, and it's very unique, is it causes also more blood coming to the area, and causes healing. So we call it, if you would, good cop, bad cop. The shockwave really almost almost inflame an area to cause more healing of the blood flow, whereas the laser soothes the whole thing.
Yeah.
And so as a soother of the inflammation, and the other, if you will, creating it, marries it perfectly, because you're doing something and then actually immediately treating it to heal it. So when you throw in, to start with, a great diagnostician like yourself, and then you bring in the platelets or stem cells and PRP, you're giving the body everything it needs to heal. And we have found over again, the last 15 years, when you have somebody who's had either stem cell injection, platelet injection, the stimulus of the sound wave and the shock wave, the sound wave and the light wave, what you're actually doing is promoting the healing at a very, very quick level.
Mm-hmm.
And
very deep level in this.
Exactly.
Yeah.
And so it's not just healing, but it's preventing the reoccurrence. Mm-hmm. And then the last thing that we're doing, and we've been working on with you, is the biomechanical side. So we know.
Correct that. We can't just do these treatments in isolation. And it can help people, and it certainly does.
Absolutely.
But what we're focused on is this prevention of recurrent injury. That
Exactly.
Keeps people off the court again and again.
Exactly. So if somebody's biomechanics is off, and you can get on any TV show, turn on the TV and you'll see them advertising, orthotics curing this and all these over-the-counter products that they say will heal back pain. Well, they're right, except these are over-the-counter. This is one size fits all. Well, unfortunately, one hammer, as you said earlier, doesn't fit all. So at your office in Tucson, the great thing is that each individual patient is seen. There's all these great therapies, leading cutting-edge therapies that, quite frankly, is found in very few places through the U.S. and Canada. And to be able to come in and get the right diagnosis from a board-certified physical medicine specialist like yourself, and then have these treatments administered under your care, this office is cutting edge, leading for not just sports medicine. These are for people who are having trouble doing their everyday tasks, whether it's walking, whether it's cleaning a house, whether it's trying to go to the golf course and hit golf balls, whether it's getting back on the pickleball court, whether it's going for a walk with your grandchildren. Age is unfortunately not on our side, and so as we get older, these body parts wear out. No different than tires on a car. And if your alignment on a car is off, what happens to your tires. So I think that the clinic approach that you're taking is one of the first I've seen in North America, where you're looking at the total body and you're presenting to the patient everything that's available out there, but choosing for them what is the best. I mean, not everybody needs a stem cell. Not everybody needs platelet. Not everybody needs shock and laser. Mm-hmm. But what do they need? And to have a physical medicine physician be able to break it down for them and get them on the right course, quite frankly, Doc, it doesn't get better.
Yeah. So it's a personalized pathway. That's what I'm always circling back to. Again, what is the ability to get to that concrete diagnosis? What do you need to do as not just a body part, a knee or a shoulder coming into our office, but a person, right? Because he's very humble over here, but he's treated athletes at the highest level of performance, and he also in his practice back in Toronto, they treat everyday Joes and Joannes like I do.
Exactly.
So we're not just talking high level performance professional athletes, although he sees that clientele too. He sees a lot of people that just, they want to perform better in life or recreational sport with the kids or grandkiddos, and we got to figure out that personalized treatment path.
100%. I think that's the unique part of this practice that you've built is that you see every patient. When I was training, and I'm sure when you were training, although you're so much younger than me, but it used to be when I did my early training, the resident would say, well, let's go see the knee in room 207. And I remember when I was first year, thankfully the surgeon turned to that particular resident and said, that knee comes with a body. That knee comes with a patient, and quite frankly, you've lived that for many years, Doc. You've looked at the total
because
picture.
Of my mentors that trained me to.
Yeah, but you absorbed it. No patient is a walking disease. Let's see that patient. It's always looking at the total picture, and you fix a knee, and then the patient's back in 4 months with a shoulder issue because their knee's so good they went and played pickleball. Okay, but we know that, and our job and your job and the place that you lead the community is being able to look at that individual patient and give them that opportunity to find the least invasive treatment for them, so that they can leave the office the same day, start the healing process, and in so many cases don't need surgery. The surgeons, the orthopedic surgeons, do an incredibly great job when it's indicated.
Of course.
Whether it's shoulder repair, knee replacement, hip replacements. I mean, they've made such incredibly great strides over the years. I mean, you can go in the morning and get a knee or hip replaced and go home that afternoon. I mean, when I trained, it was 2 to 3 weeks in hospital. So this is not under any circumstances a knock against surgery, because the surgical skills are just increasing daily. But there's so many of these patients that are not surgical. Not every patient needs a knee replacement or a hip replacement. What they need is, if you will, a major tune-up. And whether it's putting platelets in to help it regenerate, or using stem cell, and then complementing with the sound and light waves.
Mm-hmm. So we heard some of the conditions scattered throughout the conversation today. In your 25 years of doing this, I mean, who is the ideal patient to look at? I mean, specifically some of the technologies we're learning.
Sure.
You have your team in the office with us this week, embedded here, deploying these new technologies and borrowing some of his protocols that they've spent 25 years really perfecting. I mean, what are some of the ideal patients to look at this kind of technology specifically, especially speak to the ones that, I've been there, I've tried some version of laser, or maybe people have heard about shockwave, they tried a little bit of that and a little bit of this, but it never quite got them where they need to. So
exactly.
Who is the ideal patient for this?
So the ideal patient, it's the patient with pain. Foot pain is not normal. Knee pain is not normal. Shoulder pain is not normal. Elbow pain is not normal. Things that interfere with your everyday life. And so, unfortunately, what we have found and what we see is that there's a great deal of, if you will, people, practitioners out there who are not well trained in some of these modalities, whether it's shock and or laser and stem cell, using platelets. And so
there's certainly a difference between the technologies.
Oh, 100%.
One isn't the same as the
and
same.
where to use what, number one, and how to use it. And so when people say, well, shockwave failed, I tried it for 3 visits. Shockwave doesn't work in 3 visits. I've been doing this for 25 years, and probably have found that depending on which shockwave machine you use, there's so many different versions, from focal to radial, the intensity, and the operator, okay? I mean, it's sort of like saying, well, every driver who drives in Tucson's a great driver, okay? If they were, you wouldn't have any accidents going out there. So the beauty is that the leading technology in the right hands makes a big difference. So using shockwave a little bit and or using a little bit of stem cell, that's not the way to go. You need an expert in the field to guide you, make sure you're getting the right treatment, the combination of treatments, and the right dosage.
Yep.
You don't go and take an antibiotic and buy something that where you are getting 50 milligrams of an antibiotic when you really need 1,000 milligrams of the antibiotic. So 50 milligrams isn't going to work. So you would sit back and say, well, the penicillin didn't work. Well, of course it didn't work because you took 50 milligrams. But if you need 1,000 milligrams and you take it properly, guided by a world-class expert like yourself, you're going to get the results. And that's what we've seen. When there is failure, most of it is just that the people who may have done it just really weren't up to scratch, if you will, on the leading technologies.
Yeah, it's what I've mentioned in other videos, my 3 T's. So, what is the training of the individual that is seeing you or that you're seeking out to solve the problem? Right? Do they have the fundamental foundational training or additional certification training in the area that you need expertise? Like I've talked about, if you know you need surgery, probably see the surgeon. Right?
See the best surgeon you can find.
If you know you don't need surgery and don't want surgery, probably find the best non-surgical orthopedic regenerative medicine doctor that's going to have all the tools. Then the second piece, as you mentioned, is technology, because there's a lot of variability between this. Just look at cameras you own, laptops you own, the age of that equipment and how it functions. So the technology is such a big piece of my practice. And like many things, I'm always seeking out the people that I feel are best in class and are the leaders out there teaching other practitioners and physicians to do this. And then nicely, like Dr. Copeland and his team, we reached out and said, hey, we don't want to be cutting corners here. There's a lot to decipher. We're really interested in these technologies. So how do we go to a source expert, like somebody doing it for 25 years who knows the best technology to use, the best protocols to implement, and has had thousands upon thousands of patients to study this to get to that point? Because then how that translates through to the consumer, the client, the patient seeing us is we should be able to apply all that and get you there much faster. There's not as much trial and error there.
Yeah, and not only faster, but safer.
Yeah.
You want to make sure. I mean, what people don't understand is medicine, we'd like to believe it's all black and white. And you and I both know, Doc, that this is all gray. All of medicine is gray. And so when a person comes through your office, they're going to get, with being exposed to a physical medicine specialist, they're going to get the right diagnosis here, okay? That's 98% of this, okay? Because once you've got the right diagnosis, you and I easily can tell them what are the treatments available, and which treatments are the right ones and what combination works. And it's not any longer, as we said earlier, one size fits all. It's none of them. Every single patient is individualized. What is it the patient wants to do? Is it just they want to get rid of the pain? Go back to their housework? Do they want to get back on the pickleball court? Do they intend on playing tennis? Are they going back to golf? Whatever their process is, we got to understand that, you and I together, so that we can make sure that it's not just a matter of treating, but patient expectations have to be met. And I think if there's one thing that separates you personally in the Tucson area, is fulfilling the patient expectation. I've seen it in your practice, I've seen it in your training, I've seen it with your staff. And the number one thing that you've banged home to your members here is patient expectations must be met. And to a patient, that is the number one thing. You need to be able to communicate the diagnosis, you need to be able to communicate how you're going to help them move back into their life that they want to live.
Yeah. And a healthcare system that is somewhat challenging to navigate here in the U.S. Dr. Copeland is in Canada. We'll save that conversation for another day, what the healthcare system is like there. But it's a tough thing to navigate for patients. And so 2 final points that I want to finish up on. One, what are some of the most stubborn injuries that you've treated over the years with this combination that you were just almost surprised that it works so well?
So, yeah, that's a great question. I wouldn't limit it to 2 or 3. I would say plantar fasciitis is almost so widespread. Some of the literature today says 25% of the North American population will suffer with plantar fasciitis.
So for those who don't know what that is, it's a painful condition in the bottom of your foot. You get up and set weight on that in the morning. It's excruciating
Exactly,
pain. Yeah.
exactly. Yeah. So that's one of the biggies. Achilles tendonitis, another major issue. Both respond very, very well to extracorporeal shockwave and laser. Medial compartment osteoarthritis, with your help, whether you're using the platelets or the stem cell married to shockwave and laser, the success has been, quite frankly, dramatic that we've seen. As you move up the body, we're seeing what we call greater trochanteric bursitis, which is really pain on the outside of the hip. It's where the actual tendon rubs across the bone and you end up inflaming the bursa. In the old days we used to inject cortisone, but the shockwave laser combination works so well. And then we go up to what we call epicondylitis, the golfer's elbow and the tennis elbow. One's on the outside of the elbow, one's on the inside of the elbow. And so we're seeing those conditions responding so well. And then you get up higher and we get into the minor rotator cuff issues and slap tears that are, minor. We look together today at a number of ultrasounds, before and after, and we were able to see the actual healing, which you should be able to do. So, this is available. It's out there. Getting to the right diagnosis, whether it's a slap tear of the shoulder, whether it's a Achilles tendonitis of the foot, once we've got that, our protocols that you've developed are so good at treating these conditions. It allows the patients to get back very quickly. Again, meeting the expectations. I want to go back to the tennis court. We're going to get you back to the tennis court. And most of these cases that we've talked about, these conditions, none of them are really surgical, except in extreme cases. And that's very seldom.
Yeah. And it's what I share with my patients. If we work through every great non-surgical treatment we can stack around this problem, and you just don't have success, because sometimes, to be honest, we catch it as it's too far down the slope.
Exactly.
And we can hold back kind of the hands of time for a little bit, get pain reduction, but functionality, all that just isn't what it needs to be if we've lost range of motion in the hip or knee. And so sometimes some of those people are going to go to surgery, but I have patients at 2, 3, 5, 7 years, they were doing great.
Yeah, but here's the beauty. They come in, and they get the opportunity of talking to a non-surgical physical medicine guy and be able to say, look, you are surgical, and I'm going to get you to the right guy, okay? So it's again, the practice that is leading, if you will, in the Tucson area. It's not limited to only what you do. It's absolutely the diagnostic center where you can look at this patient and say, look, whatever we got here, unfortunately, is not going to work, but I'm going to get you to the right surgeon and get you back on the tennis court. Yeah. And what a great opportunity for the patient, because they get the best of both worlds. They get to find out, can I avoid surgery? I don't want to do surgery. And is there something that's going to get me back to the golf course that I can do and avoid the surgery? Or instead of wasting all my time and money, Dr. Tait said, unfortunately, surgery will work. We'll get you to the right person and get you back on the golf course. So this is a one-stop shop.
So 2 points, and we're going to wrap this up. We'll get you out of the hot seat. So for people out there that are watching this and kind of this, light bulbs are going off, things are clicking. You mentioned age. I sometimes feel and appreciate age a little differently than I did maybe even 5 years ago or 10 years ago. For people that have been sitting on the sideline of life, really, because of these conditions, what would you say to them?
So, the great thing we've learned in medicine over the 25 years is walking and exercise is great medicine, okay? So if you are sitting on the sidelines and you've got a heart condition and you've got knee conditions and you've got all these things that are holding you back from living your life, get moving, get to see Dr. Tait, get in, evaluate what can be done. Living with pain is not acceptable. And in so many cases, we're finding that fear of seeing a doctor is a horrible situation, because the number one thing that I get to hear is, I wish I would have been here 10 years ago. And I've seen people give up golf. I've seen people give up tennis. I've seen people give up walking. I've seen people give up all the things that they enjoy doing. Biking's a big one, because they have knee pain or foot pain. And I think, to the people enjoying this program, is to stop being afraid. Knowing what you have is 10 times better than not knowing what you have. Yeah. And once you find it, so many times we're able, I worked with a great organization for almost 10 years, Cleveland Clinic, one of the leading facilities in North America, maybe the world. And I was CEO of their Cleveland Clinic Canada, in Canada. And the one thing that I remember one of the great chief of medicine said to me when we started the project. He said, the beauty of Cleveland Clinic is not that we diagnose what's wrong with people, is that we fix people. And I would have to say that this is the beauty of Dr. Tait in Tucson, that Dr. Tait is not only going to diagnose you, but in so many cases, in almost all cases, if he can't fix you with the great technologies, then he'll get you to the people who can fix you.
Yeah.
One-stop shop.
Yeah, should be. Because we do that every week in my practice. If what we're working through, or what we determine as the diagnosis, really requires a surgical colleague, then we're going to get you to the best, either local, regional, or even national surgeon to get that type of treatment. So I hope this program was useful for you today. It was for me, because I can sit across the way from a surgeon as a non-surgeon, a Toronto Maple Leafs fan over here, and a Detroit Red Wings guy over here.
And neither have won anything in years.
And we can have a somewhat civilized conversation and really talk about, how do we use the best of everything? How do we use the best of non-surgical, surgical, all the things that are out there to get people better?
Absolutely.
Yeah.
Doc, it's been a pleasure.
Yeah. Thank you.
Thank you.
So if you enjoy content like this, my goal is to bring you some of the best, brightest minds and experts in different areas into my practice. We're leveraging their skill and expertise to bring new and exciting things into my practice to complement what we're doing. So if you enjoyed today's segment on the newest, the greatest, the most fun we're having nowadays in non-surgical orthopedics, click the like button, subscribe to the channel so you know when we do more shows like this. And if we can help you in any way, in the notes below the video, you'll see a link to my practice. You can click on that link, fill out a little bit of information, talk to one of the smiling, happy people on my team, and we can dig into your case a little bit and see if some of the things we talked about are right for you.